Hi everybody, I'm Dr. Ashutosh Kumar. I am an Interventional Cardiologist cum Electrophysiologist working as a Clinical Director of Cardiac Electrophysiology at Care Hospital, Hyderabad. Today we are here to discuss one of the common complaint, that is palpitation. And everybody when comes regarding that my heart rate is very high and very low, whether it is really a disease or I am having any heart disease or not, or what is the risk that I queries from the patient and I find that whether my video is going to help them or not. So let us know what is the normal heart rate and how it works. So heart, if you know or not, it start beating in the mother's womb in the 22nd day of the life, means intrauterine life. And this beating goes throughout the life, and the rate when baby is born, it is around 140 to 160, and slowly over the time when he is reaching the puberty, it reaches to around 70 to 80, and after that this heart rate remains stable during the resting between 70 to 90 depending upon the situation. And when he is started doing any activity, he or she start doing any activity, the heart rate can go up also. And this question comes, what is the highest heart rate that anybody can achieve? So we say that when the heart, what is your age, means if your age is 40, we say that 220 minus your age is the heart rate that you can achieve when you are doing any physical or mental activity. Particularly if you are going on TMT, if you want to reach a particular heart rate, like we want to see your cardiac efficiency. In that situation, we target 85% of your heart rate, and we can say, okay, you have reached to the 85% of your heart rate, you are not showing any ECG changes which is showing that you are having any blocks, or we can say ischemia. So 220 minus is means if you are 40, it may be up to 180, you can easily build up your heart rate, and that is normal. So this normal, if it is coming unprovoked, then it become a pathological situation or a disease. Means you are sitting and without any reason, if you are going a heart rate of 180, then you are having some rhythm problem, and these rhythm problem we call as paroxysmal supraventricular tachycardia. So in that situation, you may be having unprovoked palpitation, and your ECG is one of the important diagnostic maneuver, or you can say diagnostic test. So if you are getting a palpitation, and if your ECG has been done and ECG is showing around 160, 170 or even 200 plus heart rate, which is unprovoked, it need to be evaluated, and there comes the role of an electrophysiologist, what I practice. So in that scenario, 220 or 230, why it is happening? This question most of the time patient asks from us, and just I want to brief. First, we have to understand why it has happened in you or in the particular patient, and particularly I am going to impress about the PSVT. So in the PSVT, if you can see, the rhythm is regular, and we say there is a regular heart rate is ongoing, and at the same time the rate is very, very high, and there is a substrate, means there is a cause for it, and the cause is the current leak is happening between the upper and lower chamber. So if you understand, the upper and lower chamber means atria and ventricle are totally insulated structures. There is only one way of current flow, that is through the AV node. So when the current is flowing through the AV node, there is a heart rate can reach up to a level, and what we have defined 220 minus the age, that can happen. But whenever the current flow through the upper to lower chamber through the extra circuit, or what we call as the pathways or abnormal circuit, we call it a short circuit, and this lead to increased heart rate of around 150 to 250 depending upon the type of conduction it is happening, and that is called PSVT. So this abnormal circuit, wherever it is located between the atria and ventricle, we are going to find by doing some studies, and this study we call as an EP study. So in the EP study, we are going to check whether the current leak is happening at what level, and what is the location of this current leak which is abnormal. So this current leak, by the 3 wires we are going to keep in 3 locations, and we see from the computer system that particular location is having the abnormal connection between the upper and lower chambers, what we call as a pathways, and then we just target that particular location by the laser therapy, what we in terminology we call as a RF ablation, and that get cured, means the condition, the conduction is not happening from that particular abnormal circuit, and you are totally cured of this condition. So PSVT is one of the curable form of disease. If somebody is diagnosed, they should feel happy that something is we have to know where it is happening. That is only been confirmed by doing a EP study. And if you are taking the medicine, we are suppressing the disease by reducing the conduction through the abnormal pathway. The second query comes from the patient that whether this can be treated with medicine. Yes, medicine is one of the treatment for this disease, but it suppresses the time you are taking the medicine. Sometimes the conduction through the abnormal will be suppressed, but time and again, whenever the extra beats has come from the upper or lower chamber, it will activate, and there is no predictability of the medicines, and that's why worldwide leaders in the cardiology and electrophysiology, they recommend EP study RF ablation as a class 1 indication. Class 1 indication means this is the first treatment to be given to the patient who are having PSVT. So PSVT, you should know that it is electrical problem. Heart will be totally normal, means if you are doing the ECG when you are not having the complaint, and if you are having the echo, even the angiography, all will be normal. It is a paroxysmal, means it will happen at a particular time, and whenever it is happening, that time you will be having the palpitation. If you are an elderly patient, you may not get the palpitation as a main complaint. That time you may be having some giddiness, and sometimes the people sustain injury due to the fall. So in elderly patient, this PSVT may present as a fall also. And that's why if a person is getting repeated fall, he should go to the electrophysiologist. They will get the reasoning, and probably this fall can be prevented or even cured by doing the EP study RF ablation. So just in summary, PSVT, paroxysmal supraventricular tachycardia, is one of the arrhythmia in which the current leak happen through the abnormal pathway or substrate from the upper to the lower, means atrium and ventricle, other than the normal conduction through the AV and AV node, and that is the reason the patients develop this type of arrhythmia. Usually it is this type of problem is present since birth, but the maturity of the abnormal pathway happens over time. Sometimes it happens at the age of 5 or 6 years. Sometimes it get matured. This abnormal circuit get matured at the age of 90 years also. So when a person get the maturity of that abnormal pathway, the patient will be having this palpitation, and then this arrhythmia will be happening on and off over the time. And EP study RF ablation is a curative form of treatment. After that, you will not be taking any medicines, and most of the time, if the recurrence is not happening, you are totally free from this disease. So thank you so much, and next time again we will be meeting with some important insight regarding other heart related disorders or problems. Thank you so much. Keep watching. See you next time. Thank you.